Before you start taking Ibrance 100 mg capsule, make sure to read the Patient Information Leaflet from your pharmacist. Take this medication by mouth as directed by your doctor, usually once daily for 21 days, then stopping the medication for 7 days. This is one cycle of treatment. Continue taking the medication this way as directed by your doctor. The dosage is based on your medical condition, lab tests, response to treatment, and other medications you may be taking. Your doctor may stop your medication for a while or reduce your dose if you get any side effects. Remember to take this medication at the same time every day as scheduled. Do not increase your dose or use this drug more often or for longer than prescribed. Avoid eating grapefruit or drinking grapefruit juice while using this medication unless your doctor or pharmacist says it's safe. Use this medication regularly to get the most benefit from it. And lastly, if you're pregnant or may become pregnant, avoid handling this medication or breathing the dust from the capsules. Some common side effects of Ibrance 100 mg capsule: Antineoplastic, Cyclin-Dependent kinase, CDK, 4/6 inhibitors include nausea, vomiting, loss of appetite, diarrhea, tiredness, weakness, hair loss, mouth sores, or numbness/tingling of arms/legs. If any of these effects persist or worsen, it's important to notify your doctor or pharmacist promptly. Although there are potential serious side effects associated with this medication, your doctor has prescribed it because they believe the benefits outweigh the risks. Your doctor will carefully monitor you to decrease your risk of serious side effects. It's important to contact your doctor immediately if you experience signs of anemia, easy bruising/bleeding, signs of lung problems, or any signs of infection, as this medication may lower your ability to fight infections. Additionally, if you notice any symptoms of a serious allergic reaction, seek medical help right away. This is not a complete list of possible side effects, so if you notice any other effects not listed here, be sure to contact your doctor or pharmacist. If you're in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before starting to use Ibrance 100 mg capsule, make sure to inform your doctor or pharmacist about any allergies you may have or if you have a history of liver disease. This medication can increase your risk of getting infections or make existing ones worse, so it's important to avoid contact with anyone who has a contagious illness. It's also important to let your healthcare professional know if you are planning to have any vaccinations or surgeries while taking this medication. Additionally, Ibrance can affect fertility in males, so it's important to discuss this with your doctor if it's a concern. If you are pregnant, planning to become pregnant, or breastfeeding, it's important to talk to your doctor about the potential risks and benefits of using this medication, as it can harm an unborn baby. If you or your partner becomes pregnant while using Ibrance, it's crucial to seek medical advice immediately. Lastly, women who are pregnant or may become pregnant should not handle this medication or inhale the dust from the capsules, as it can be absorbed through the skin and lungs and harm an unborn baby. It's important to be aware of potential drug interactions that could affect how Ibrance works in your body. Make sure to keep a list of all the medications and herbal products you use and share it with your doctor and pharmacist. Don't make any changes to your medication without consulting your doctor first. Certain medications can impact how your body removes Ibrance, which may affect its effectiveness. Examples include azole antifungals, such as itraconazole, ketoconazole, carbamazepine, phenytoin, rifamycins, such as rifampin, and St. John's wort. Be sure to discuss any potential interactions with your healthcare provider. If you or someone you know has taken too much Ibrance and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the US, you can call 911 or contact your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center for assistance. It's important not to share this medication with anyone else. Before starting this medication and while you are taking it, your doctor may recommend lab and/or medical tests, such as a complete blood count. It's crucial to attend all medical and lab appointments as advised by your healthcare provider. If you forget to take a dose, just wait until the next day to take your next dose at the usual time. Do not take 2 doses at once to make up for the missed one. It's important to store Ibrance 100 mg capsule antineoplastic, cyclin-dependent kinase, CDK, 4/6 inhibitors at room temperature, away from light and moisture. Make sure to keep it out of the bathroom and away from children and pets. When it's expired or you no longer need it, make sure to properly discard this product. You can consult your pharmacist or local waste disposal company for more information on how to do this. Remember not to flush medications down the toilet or pour them into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.